The following program was produced by PACTV in accordance with the agreements PACTV has with the towns we serve. The content of this program does not reflect the views or opinions of the PACTV staff or board of directors.
Welcome everyone to Delicious and Nutritious. We're recording from PACTV and Center for Active Living. One quick announcement is that we have modified our Zoom system a little bit, so you have to register. It's critical that you register. Beth has sent out an email, and it's very simple. You just click on registration, you put in your name and so forth, and you will get a link. And we'll make sure that you have an understanding of how to use that link. Okay, today we are going to talk about hydration. And what is hydration? Hydration is making sure that your body has enough liquid. Why is that important? The body needs to function, and the liquid is a critical factor in allowing the body to function. You know what happens when you become dehydrated. You get a little lightheaded. You feel kind of discombobulated. Love that word. But the point really is hydration is critical, especially now during the summer. The other thing is, especially for those of us that happen to have white mustaches, meaning we're a little older, and so hydration's critical, and it is really something you will feel so much better. That's one of the few things that was positive that I learned from the military. One of the many things, actually. Anyway, what we're going to do is we're going to do a lesson, and mostly by Marcia, and she will talk about hydration, what it means, why it's important, and then I am going to show you how to make Jerry's summer iced tea, which is downright delicious. Anyway, Marcia, take it away.
All right. Hi, everybody. Welcome. It's nice to see so many new faces. For those of you who don't know me, my name is Marcia Richards. I am a registered dietitian and certified health educator. And Jerry and I have been working together for several years now, promoting nutrition and cooking, or chefery, which is my new favorite word. So today's focus is hydration. I am going to share my screen so you can see my PowerPoint. So everyone should be able to see that? Yeah? Okay, awesome. So as Jerry mentioned, today's topic is on hydration. What I'm hoping that you'll all be able to do is be able to state one health benefit associated with being adequately hydrated, identify one food and one beverage to have that will promote adequate hydration, and also learn how to prepare Jerry's summer mint iced tea. And there's also going to be a stump the chef question as usual. So I'm going to use the water interchangeably for fluid. So why is water so important to our bodies? Number one, it acts as a solvent. Because of this, it helps to dissolve the nutrients that we get from the foods that we eat, so that every cell in our body can use those nutrients, whether it's a bone cell, a brain cell, muscle cell, skin cell. Every cell relies on nutrition. That's what nutrition is all about. Water acts as a cleansing agent. People are going on cleansing diets and detox diets. You don't need to. Our body knows how to clean itself primarily through the fluid that we consume. We get rid of most things via the kidneys, some via the feces as well. Water acts as a lubricant or a cushion along our spinal column, our eyes, our mucous membranes, our digestive tract. Water is necessary to keep all of these parts of our body moist, lubricated, and working well. Water acts as a coolant on hot summer days. There's a whole process that happens that makes us sweat so that we cool down. We need fluid in order to have this sweat. Water is also a carrier, carries nutrients around the body, also carries waste out of the body. And water makes up about 60% of our total body weight. So most of our weight is water. All of these things result in health benefits. Normal blood pressure, good brain function or cognitive function. Jerry mentioned when you get a little bit dry, you might get a little hoopy. And being confused is a real common sign of symptom of mild dehydration. Skin health, if you want to have nice, supple skin, drink plenty of fluid. Normal bowel function. We need fluid, especially if you're consuming fiber, which I'm always promoting. You need to have some fluid to moisten up your stool as well and keep things moving through. And adequate fluid is also going to help prevent urinary tract infections, which are very common as we get older and can cause a lot of problems too. So the topic of water balance consists of hydration, which means we have a good water balance. We are not getting rid of more fluid than what we take in. Dehydration is when we're losing more fluid than we take in. This can happen because we didn't consume enough fluid. It could happen because we're too hot and we're sweating too much. It can happen because we have diarrhea. It can happen because of vomiting. So there's a lot of reasons why dehydration can happen, but it's a loss of water and it's very dangerous. It's going to impact your heart, it's going to impact your brain, and can also impact your whole digestive system. Water intoxication is the opposite end of the extreme. It's overhydrated, and what can happen is our body fluids become dilute, so all those important nutrients that we need to send the messages and do all the things that they're supposed to do, they become dilute, so things don't work as well. So very briefly, some mild dehydration symptoms, just being a little bit low in water. If you get on a scale today and you weigh 130 pounds and you get on the scale tomorrow and you weigh 125, you have lost 5 pounds of water. We do not lose fat that quickly. It takes quite some time to lose a pound of fat. So if you notice distinct changes in your weight day to day, you could be holding on to fluid. Some people have that issue, or possibly losing fluid. Mild dehydration symptoms might be thirst, weight loss, dry, cool skin, mouth might feel dry, pulse might change. You might feel very weak. You might not be thinking clearly. You might have a headache. You might not be urinating as much. Your body's going to try to conserve. Severe dehydration, losing more than 5% of your body weight. You might notice significant changes in your skin. You might look pale. You might have a bluish tinge to your lips. Your fingertips might also have a bluish hint. Very confused and disoriented, rapid, shallow breathing. Some people will have seizures. If you ever watched a marathon or a big race, Ironman, those things, people are dropping like flies sometimes at the end of those long races because of dehydration. And severe dehydration can result in death. So it's an important issue for us to talk about. So some people just have a chronic low fluid intake, maybe constant and a mild dehydration, and that can pose some health risks. It can put your heart at a greater risk for problems like a heart attack or cardiac arrest. Constipation, I work with lots of people who are constipated, and the cure is usually to drink some more fluid. And it's amazing, it's a miracle. Dental disease, we have saliva. Our mouth is supposed to be moist to protect our teeth from the bacteria that is naturally present. Gallstones, glaucoma, which is a eye disease that results from increased pressure in the eye. hypertension, which is high blood pressure, kidney stones. People who do experience kidney stones are encouraged to drink plenty of fluid to keep things good and dilute. Stroke, and also urinary tract infections. So lots of symptoms associated with being on the dehydrated side. So there are some challenges when it comes to getting adequate fluid as we get older, especially. So if you look at this chart here, a fetus, almost 100% of their body weight is water. At birth, it drops down to about 80%. Normal age adult is 50%. These are water reservoirs, and you might not have enough adequate water on board. Older, it's even more important to drink enough fluid. One of the best ways to determine if you are adequately hydrated is by the color of your urine. So if your urine matches these colors 1 through 3, if your urine more like these colors, you are dehydrated, issues, and you've been instructed to do things different than what I'm saying, you need to take the advice of your healthcare provider. So, what can you do today when you brush with some water? Have something to drink or have a piece of fruit midday. Have lunch with fluid. Have milk, have tea, have juice. Coffee and tea are mild diuretics. They are good sources of fluid. Alcohol, on the other hand, is not. Water, milk, juice, a piece of fruit provides 95% water. Tea, coffee, vegetables, soups, puddings, ice creams, great sources of fluid. And as I mentioned, an alcoholic beverage, please have a nice glass of water with it so that you can stay hydrated. Avoid fluids that have a lot of added sugars and salts. So take a look at labels, and if you notice that there are added sugars in a beverage, keep in mind that every 4 grams of sugar equals 1 teaspoon. So if you see 12 grams of added sugar, you're consuming 3 teaspoons of sugar. So we just don't want you adding sugar as you're adding fluid. So Jerry is going to share with us his tea for the next 30 seconds or so. Great thing about tea is it is naturally low in sugar unless you add something to it. It is a great source of fluid. Tea contains phytochemicals called polyphenols, 2 of which are called catechins and epicatechins. And studies are showing that these particular polyphenols might lower the risk of diabetes and heart disease because they are antioxidants and they also have anti-inflammatory properties. So we've talked about cells earlier, and we want to keep our cells healthy. So antioxidants and anti-inflammatory properties help to keep cells in our body healthy. And if our cells are healthy, then our body is healthy. Black tea, which is the primary tea consumed in the US, studies have shown that having 4 cups of tea per day might reduce the risk of stroke. Studies that I looked at show that drinking green tea might improve your blood pressure and also lower your lipid levels. At any rate, more research is needed, small studies, some were done on mice, some were done on rats, some were done in a test tube. Some are great for you. What I would recommend, though, is that you drink tea, not tea supplements. So if you do pick up a can of something that says tea, take a look at the label and make sure that it is actually tea versus some sort of an extract or a supplement. So we'll have time to take questions later if you have any questions on any of this information. But I'm going to swing this back over to Jerry, and tea, a little bit of sugar, cinnamon, some fresh mint, and lime juice. And this came out to about 20 calories for 8 ounces. So I'm going to stop my screen share and flip this back to you, Jerry.
Okay. Marcia, can you go back to the tea recipe? Can you go back to the tea recipe? Okay, that's quite all right. Basically, I am going to, here we go. All right. This is a very simple recipe. Probably the most complex thing here is that we do have mint leaves, which come out of our garden, and you need to kind of shred the mint leaves. And I'm going to show you how to do that in a moment. You boil 2 quarts of boiling water, and for the first time in doing these shows, we're going to actually plug a product. And the reason being is that there are a number of different types of teas. There's black tea, there's green tea, there's white teas, and they all have a different flavor profile depending upon what's in them. The tea that we're using here is something called Constant Comment, and it is produced by a company called Bigelow. Now, this is what the container looks like. There are 4 tea bags per little packet, and I happen to have designed this thing so there's 4 tea bags. Now, what else do we have in there? We have turbinado sugar. If you can see, this sugar is what is called a raw sugar. And the reason I use it, because there's a tiny bit of molasses in here. That tiny bit of molasses adds a really nice flavor profile to it, and it gives you a nice complexity. Cinnamon sticks. You buy them in the supermarket. I use 3. Okay. So, and the next thing is, let's do our mint leaves. So you basically take 2 of these, and you kind of take it, and now you can see that I'm just gently removing it from the stem, tossing
Marcia,
the
take
stem
down your
aside.
screen.
And there we go. And what we're going to do now is we're going to basically shred it, and I'm going to show you what it looks like after I shred it. And it's really simple. You know, you just grab a bunch of it and you do a little twist. Okay. So we've got that done. So what we need now is our water and our container. So this is a gallon container, or 4 quarts. You'll notice that it's half full, and it's half full because I'm only making 2 quarts, which is a half a gallon. So what we're going to do is we're going to take our tea bags, and we're going to drop them into our container. We're going to take our cinnamon sticks, and we're going to drop them into our container. We're going to take our turbinado sugar. You can use white sugar. You can use brown sugar. You can use light brown sugar. They will all have a slightly different taste, flavor profile to them. I like the turbinado raw sugar, and it is readily available in every supermarket. So, mint leaves, in you go. And the next thing we do is our favorite wooden spoon. Let it stir and let it sit on the counter for 2 reasons. One, the various components are infusing together, they're coming together, and they're making a nice complexity. And the other thing is it's cooling itself down, and this tea, of course, is going to be stored in the refrigerator.
Jerry, you muted yourself.
I am sorry about that, Tom. I am now unmuted, and I'm going to start where I just finished, which was we make probably 2 or 3 of these containers on a weekly basis. And it's very refreshing, and It's relatively low in caffeine, and so it's a wonderful source to hydrate. And caffeine, of course, caffeine level in teas generally have less than the caffeine level in coffee. So that's an advantage also. So that is Jerry's Summer Mint Tea. And I'm willing to answer any questions. I will say that this mint comes from our garden, our herb garden, or what I like to call the kitchen garden. And it comes from our garden. You can buy the fresh mint in any supermarket. There isn't anything here that's overly complex. I did forget to tell you one other thing that was I should have added, which was 3 tablespoons of lime juice. It's in there now. And we're going to let this sit and become complex and cool off. So if anyone has a question about this tea, I'm happy to answer it.
I have one, Jerry.
Yes,
Is
Tom.
it only that tea that's good to do it, or can you use any tea, or is it just the flavor of that one you like?
Tom, that's a very good question. And the reason why I use this tea is because it says our first and only famous blend flavored with secret recipe of orange wine and sweet spices. If we use just a regular black tea or a green tea, you would not get the complexity of this tea.
So that has more flavors to it then.
Exactly, Tom.
Okay.
And that is where the complexity comes in here. This is an old recipe that I've used for years, and I've stumbled on it fooling around one day in a kitchen. And I really like the combination of the black tea and the citrusiness, and there's also a sweet spice, and the cinnamon brings that up also. I mean, if you want to make it even more complex, put some allspice in there, or put in a little bit of vanilla. But I don't suggest you do that. I think this recipe is very simple, straightforward, and the little hint of the citric acid coming from the lime juice adds a nice complexity to it. Okay, Mary, did you have a question?
I couldn't hear what kind of juice, but it's lime, L-I-M-E, that you just said.
That's correct. And you can either squeeze your own lime juice, or you can buy a bottle of it from at the supermarket. Keep it refrigerated.
I lost your picture when you were shredding the mint leaves, but you just shred them into little pieces?
Okay, essentially what you do is you strip the spine of the mint plant, and then you just break them up into half-inch pieces, quarter. This isn't rocket science. And
I have mint in my backyard, so I can use it.
You can use it. Do it.
Yeah.
It works extremely well.
Thank you.
Okay. Other questions? All right. Then what we're going to do is we're going to go back to Marcia, and we've got about 7 or 8 minutes left. And so, Marcia, it's all yours.
All right, so I am going to have Jerry stump chef question in a minute, but I think I'll try to some answers from our audience. So our objectives were that you could name a health benefit associated with adequate hydration. Would anybody like to share one health benefit from being adequately hydrated?
One of the benefits of being, okay.
No, not you. You don't get to. You already know the answers. We're going to choose Marilyn.
Okay, unmute Marilyn.
Unmute yourself, Marilyn. You already know the answers, Jerry. So Marilyn is going to tell us.
Can I answer?
Yes.
It helps to relieve constipation.
Perfect. Excellent. And nobody likes to be constipated.
That's right.
All right. Anybody else? Would Suzanne, Mary, Barbara, or Rachel like to share? Oh, Sharon, sorry. I don't have my glasses on. No, I don't see any hands up. All right. How about, Marilyn, you want to tell us another one?
Yes, it's important for your cells.
Perfect. Nothing
Keep
like
your
a good,
cells
healthy
hydrated.
cell. Oh, thank you. Rachel just offered plenty of water helps to relieve muscle aches and pains. Very
Yes.
good. Excellent. How about a good food to have? Let's say, you're just tired of drinking water and tea, but you want to have a food that is a good source of fluid. What would be a food? Mary?
Watermelon.
Watermelon. Excellent. And you can just feel how much water it is. And Rachel is also sharing watermelon. Would anybody else like to share a food? No?
How about an orange?
An orange would be awesome too. Fruits and vegetables are 90% water. So a lot of times we're getting more fluid than we realize. And what is one of the best ways to check you are adequately hydrated? What is it that you can take a look at? Mary?
I was told that if somebody was dehydrated, you could take your skin and pinch it up and it would stay up a little bit.
You can pinch your skin, and depending on how long it stays. What else could you look at? Rachel, I did just see urine output you mentioned. What else about the urine could you take a gander at?
The color.
The color.
Mhm.
So it should be clear to a pale yellow. If it becomes more concentrated, a brighter yellow. I do want to mention, if you take a multivitamin in the morning, first urine after that might be bright yellow. It just has to do with sometimes the stuff that's in the vitamin. But throughout the day, don't be afraid to look at your urine and see what color it is, because it could help you to remind you to drink a little bit more fluid. All right, awesome. You all passed my final exam. Passed hydration.
I have
So,
a
Mary?
question.
Yes.
I have a question.
Okay.
I drink a lot of decaffeinated coffee and tea, and I don't think you mentioned decaffeinated. What's
That
your,
that'd be fine.
okay.
That would be fine. Yep, it's still going to be fluid. Caffeine, a lot of times they used to say coffee and tea didn't count as fluid because they act as a diuretic. But it's a pretty mild diuretic, and what research has shown is most people kind of adapt, and it's not necessarily dehydrating. Alcohol, however, is very dehydrating. So I always encourage people to make sure they drink extra fluid in the setting of alcohol. Naturally, please don't drink a lot of alcohol. But your decaf coffee or tea is also going to be a good source of fluid. Oh, okay. So Jerry, this is a wicked easy stump the chef question.
Go for it.
Where did tea first originate?
Well, that's a good question. What I heard was that there was a Chinese emperor sitting in his patio with his food dogs and all kinds of other things, and there was a tea tree right next to him. And some of the leaves fell into his cup of boiling water. Now, this guy had never tried anything like this, but he sniffed it, and there was a lovely little aroma to it. And then he tasted it, and he turned to one of his ministers, and he says, "What is that tree? I love this stuff. Pick the leaves, make me tea." How the name tea came about, I have no idea, but that's the story I've heard.
And once again, I was not able to stump Jerry. That was what I had heard too.
Marcia, it's really important that you give me the questions before we do the show.
I don't though. I never give him the questions before. Half the time, I don't even know what they are until they pop into my head right now.
Tea is very famous in India. They grow it up in the mountains. The Japanese certainly like it because of the Chinese influence into Japan, and the Chinese have magnificent teas. But the Orient is where it originally came from, and the Brits, when they finally figured out what was available in the Orient, they went there and they started harvesting the tea and bringing it back, and that's why we now have a free country, and we had the American Revolution, primarily because of the tax on teas. And we,
Yeah.
those of
yeah.
us from Boston, tossed the teas in the water and
Yep,
said,
yep.
"Go with you, we don't want to be with England anymore."
Yep. You even get a history class on delicious and nutritious.
Well, we can do that too.
Yeah.
We are coming down to a summation. And Marcia, I learned a lot today. This was a very good show. And
Good.
I think the information is really very useful, especially for those of us that are a little bit older. Hydration is critical.
Yes.
It's a major component in life, and doing it properly, you'll feel so much better if you're properly hydrated.
Yeah. Yeah.
So,
And we love doing this show. This is what we're all about providing you with the information and the education, and also some practical strategies in your everyday life through the foods you eat and drink. That's what Jerry and I are trying to do with Delicious and Nutritious, and we love it. And we welcome any comments and any suggestions about shows. Next week, we're going to do shish kebab, I believe. We're going to grill.
That's correct.
So that'll be a lot of fun, grilling on Zoom. It'll be a new experience as we learn more about technology, because please keep in mind, I'm a dietitian, Jerry's a chef.
We don't have a rainy day, because I'm planning on doing this on the Barbie.
Yep. I'll come over and hold the umbrella.
Somebody's going to have to.
How are we with time?
I think we're about there. Tom, is that correct?
Yeah, that's it, Jerry. We are there.
Okay.
All right.
Everyone,
wonderful.
thank you for coming and watching our presentation. Talk to your friends. Let them know what we're doing here. We've got some really good advice, and we have a little bit of fun when we do it. So
Sure.
Take care. Enjoy the weekend. Marcia, it's all yours.
Thank you.
Take care. Drink